Hello, and thank you to everybody for joining us today. I am Megan Grusczynski, Financial Planning Specialist here at Revolve Wealth Partners. We're here today to talk about initial and annual open enrollment for Medicare. We are joined here today by Linda Cosgrove of Senior Insurance Associates. Linda, as a Medicare specialist, helps people make these important healthcare decisions every day. Her focus at Senior Insurance Associates when helping clients is to educate and assist folks in finding coverage that is reliable and the best fit for their needs and lifestyle. Linda, thank you for joining us today.
Thank you, Megan, for having me. To tell you a little bit about me, I'm an insurance broker with Senior Insurance Associates. I've been in the Medicare industry for about 10 years and the insurance industry for many, many more. I'm very excited to be here today to share this important information with all of you.
As are we. And before we dive into the materials, I would just like you to know that we are recording this webinar and we'll be making it available for sharing in the days ahead. If you have questions, we will be providing contact information at the end of the webinar. So let's get started. To begin, we would like to review the components of Medicare. Linda, can you speak to what Medicare is and its basic structure?
Sure. So Medicare is health insurance for people that are over 65 and those under 65 that are disabled. If you are 65 and you have access to employer coverage that is credible by Medicare standards, you would be able to delay your Medicare until you retire. And if you have employer coverage with an HSA, you may not want to take Medicare at 65 as well, A or B, until you retire because you cannot contribute to an HSA while on Medicare. So when it's time to join Medicare, if you're already receiving your Social Security benefits, you will automatically be signed up for Medicare Parts A and B. If you're not receiving Social Security benefits, you would be signing up for Parts A, which is your hospital, and Part B, which is your medical, to cover all of your medical expenses through Medicare. Now, Parts A and B alone do not cover everything. So this would leave you with significant out-of-pocket costs. To cover most of these costs, you would need to decide whether you want original Medicare or whether you want a Medicare Advantage plan.
Great. So if you were to opt for original Medicare, how would you ensure that you have complete medical coverage?
So with original Medicare, along with your Parts A and B, you would also choose a Medicare supplement plan. And then you would choose a prescription plan to round out your coverage. With original Medicare, there's no networks. You can go to any doctor, hospital, or facility anywhere in the country as long as they take Medicare. There's usually very low out-of-pocket costs for your medical expenses on the original Medicare side.
And what type of coverage might you expect with a Medicare Advantage plan?
So Medicare Advantage plans are predominantly HMO PPO plans. And just like the employer-based coverage you may be accustomed to having. They're government plans. They're sold by insurance companies based on your zip code. They have a maximum out-of-pocket of $7,500, with the maximum being lower in certain areas and certain plans. They have a low or zero premium after you pay your Part B premium. And there are additional benefits to Medicare Advantage plans like transportation, dental, vision that original Medicare does not have. The most important thing about this slide is to know that everything on this slide are government plans except for the Medicare supplement plans. These are insurance policies. So they must accept you automatically without underwriting when you first sign up for Part B and within the first year of being on a Medicare Advantage plan. There are exceptions in the states of New York, Massachusetts, and Connecticut, but after those time periods, they don't have to accept you without underwriting.
So, regardless of whether you choose to take the course of an original Medicare policy with a supplemental plan, or you opt for bundling everything together in an Advantage plan, can you provide a bit more detail on the basic components of Medicare coverage, starting with Part A?
Yeah, so for Part A covers the semi-private room when you're in the hospital, You leave the hospital and go to a rehab or nursing facility, it will cover that as well, including physical therapy that you'll receive at home. Part A covers your hospice, manages symptoms of controlling pain for the terminally ill, and it covers skilled healthcare in your home if you're homebound and you only need part-time care, usually after leaving a facility or a hospital. Part A has a zero premium as long as you and your spouse have worked in the United States for 10 or more years.
And as we talk about Part A, something important to keep in mind is that while Part A covers some skilled home care, it does not actually cover you in the way a long-term care policy might. Long-term care is designed to cover services such as long-term care for disability and chronic illnesses. And if you find that you have questions around a policy like that, please know that we're here to talk to you about that.
Yes. And so going on to Part B is your medical coverage. And this is going to include all your doctor visits, including your annual wellness exam. It will include any outpatient medical services you have and preventative care, such as flu and pneumonia shots. This will include all your x-rays, MRIs, CAT scans, any kind of testing you have, and any durable medical equipment that you use at home, oxygen, walkers, wheelchairs, if you have diabetic machines or supplies. That's all covered under Part B. Part B is income-based. So the higher your income, the higher premiums will be.
Thank you. And then, so that covers original Medicare Parts A and B, but thinking about the process for making sure I have prescription coverage, what are the steps there?
So for prescription coverage, if you're on the original Medicare side, you would choose a Part B plan, a prescription plan. If you're on a Medicare Advantage plan, the Part B is included. You can't buy a separate plan from your Medicare Advantage plan to cover your drug costs. You have to take the one that comes with the plan. With original Medicare, you have a variety of options to choose from, which we'll talk about in a little while. But it's important to know that if you do not obtain Part B or D, and B is the medical and D prescription, within a certain time frame, then you are subject to penalties. Some of the penalties are lifetime. Some you'll need to pay attention to so you'll need to pay attention to these timelines. If you're not on any prescriptions, unfortunately, you still need to join a plan. The government will still expect you to join a plan. And I usually advise those people to just choose the lowest premium plan, which you'll be able to change every open enrollment. Right now, that plan is about $7, depending on where you live.
Great. And as you mentioned a moment ago, Medicare Advantage, also called Part C, includes all of these components, meaning your Part A, B, and D coverage. Can you tell us a little bit more about that?
Yes. So for Medicare Advantage plans, these are managed care plans. So they're HMO, PPOs, like you've probably been used to having. The types and premiums may vary. So there are zero premium plans for Medicare Advantage, zero premium after you pay your Part B. And then there are plans that have higher premiums. You must use the doctors or hospitals within the plan. On the PPO plans, you can go out of network on those plans with a higher copays and coinsurance, and you may need referrals on these plans. Most of these plans are local plans or regional plans, so you just can't pick up and go across the country. You usually have to stay within your area.
That's very important as well. And now thinking about original Medicare, you touched on this earlier. You would also need to purchase a Medicare supplement policy, both for added coverage and protection against high out-of-pocket costs.
Yes, that's true. There are a variety of plans that are available with various degrees of coverage. These plans are paired with Part A and B and D, the prescription side, and they are the same plans no matter which insurance company you choose. The difference will be the cost of the plan and the rating, how they came to those premiums, which the rating can make a significant difference moving forward on how your rates increase. So it's important to understand that part.
And thinking about the plans themselves, can you explain the various options that you have when looking into a Medigap or supplemental plan?
Yeah, so there's a few options available, and the premiums differ by state or location. So the most comprehensive option for a Medicare supplemental plan is the G and N plans. So the G plan provides almost 100% coverage, except for the Part B deductible, which this year was $233. And the N plan provides a comparable amount of coverage with copays. This is something we walk our clients through to help you understand what best plan works for their lifestyle. And for those of you who are receiving items in the mail detailing the many plan letters and can't decide what to do, this is what we're here for, to help you understand.
That's great. And then can you explain the ratings to us?
Yeah, so basically, there's two most popular ways to rate these policies: community rated or age attained rated. With community rated policies, the rates are based on the health of the community, and the rates will never increase due to age. With age attained policies, your premiums will continue to increase as your age increases.
And now we touched on this high level, but let's dive into a little bit more detail on the prescription plans.
Yeah, so the prescription plans are government plans as well, and they pay for a portion or all of your prescription costs. They have a relatively low premium. Plans are structured like this chart here. There are four stages for these Medicare plans. They all basically look like the chart. In the first stage, you'll have your Part D deductible. The deductible only applies to tiers 3, 4, and 5. Next year, they added a couple plans that are showing the deductible in tiers 2. So it's something you may want to pay attention to if your plan has changed to include that deductible there. In the second stage, your medications are broken down into 5 tiers. Your copays and coinsurance are going to be determined on what stage your plan has your medication, what tier. So tiers 1 and 2 will be mostly your generics. Tiers 3 will be your brand. 4 and 5 mostly specialty drugs. Note that there are preferred pharmacies and standard pharmacies, so always make sure you know what the preferred pharmacies are for your plan. If you use the preferred pharmacy, you will get a lower out-of-pocket cost. If your medication costs reach $4,330, you will now be in the third stage, the coverage gap, also known as the donut hole. You will then be responsible for 25% of the cost of your medications. And if your medications reach $6,550, then you'll be in catastrophic phase and you'll be responsible for 5% of the cost of your medications. So sometimes during those stages, people are calling me. We're trying to get help with the medications and get coupons for them. And the one thing to note on this slide is that you will have the opportunity to change your plan once per year during the annual enrollment period. Medicare has a tool to help you compare plans based on your medications at that time, or we always are available for help as well.
Great. So basically here on this next slide, we're recapping everything we just discussed. So first we have original Medicare, where you would get your Part A and B, then that prescription plan, followed by a Medicare supplemental plan. Your other option overall is to opt for a Medicare Advantage plan. They group all components into one plan and they are local or regional plans. Correct, Linda?
Yes, that is right. And the Medicare Advantage plans can be changed each year during the annual enrollment period, as well as the Part D drug plans.
And for those folks who are with us today and are not yet enrolled in Medicare, there's a lot to consider. As you approach your 65th birthday, one big thing on folks' minds tends to be, am I going to retire or will I continue to work? And how does that play into what I will need to do about Medicare? Can we talk a little bit about that?
Yeah, so if you're approaching 65 and you're going to continue to work, you do have options. If your company has more than 20 employees and you have coverage that is considered credible by Medicare, then you can take your Part A and delay your Part B and D without penalties until you retire. If your company has less than 20 employees, then you will need to go on Medicare.
And, this is something that you always want to talk to your HR team at work about, just to make sure that the insurance coverage you have, if you are working past 65, is sufficient for you to stay on to avoid any Medicare penalties.
Gotcha.
And if you are on that employer health insurance and you're currently enrolled in a high deductible health plan with an HSA, when would you need to stop contributing to such a plan to avoid a penalty?
Yeah, so you should generally stop contributing to an HSA 6 months before transitioning to Medicare. You cannot contribute to an HSA and be on Medicare. Parts A, B, D, or C, or any part of Medicare, you can't contribute at the same time.
And if you're thinking about retirement and want help evaluating options surrounding something like this, please don't hesitate to reach out to us to discuss. And now, there are key factors to consider when choosing which plan is right for you. So to look at things side by side, there are certainly advantages to each type of coverage. But how do I know what's going to be the best fit for my personal needs?
So yes, there are things that come into play when choosing whether or not you want to take original Medicare or a Medicare Advantage plan. If you travel, have multiple residencies, or have several doctors, you may want to stay on the original Medicare side with a Medicare supplemental plan and a Part D plan. But if you're living in an area with good Medicare Advantage plans, you have doctors that are mostly in-network, and you may not be able to afford the premium for a Medicare supplemental policy, the Medicare Advantage side may be better for you. Just remember, you may not be able to get a Medicare supplemental policy if you don't take one at the beginning or within the first year of having an Advantage plan. And one thing to note is that it's never a good idea to just have original Medicare Parts A and B with no kind of supplement. There are penalties involved for not having a prescription plan. There's no cap on the amount of out-of-pocket costs that you can incur by just having Medicare Parts A and B. You would be responsible basically for 20% of everything on the Part B side with no cap. So if it's $100, no problem to pay 20%. But if we're talking about $1 million in healthcare costs, 20% can be a lot of money. And in today, that's not difficult to, to incur those kind of costs.
Of course, of course. And similar to how we work with clients through standard open enrollment, as some of you may be familiar with, this is an area that we're all here to offer assistance and be a sounding board through this process to help make sure that the choices you're making do fit within your lifestyle. So moving on, there are certain timelines that you need to follow for Medicare. And there are certain enrollment periods as well that give you the opportunity to join or change plans. Can you explain these to us?
Yeah, so your initial enrollment period is going to be when you're turning 65. For some people, it might be when you become disabled after being on Social Security disability for 2 years. But for most people, it's going to be when you turn 65. If you, your effective date for Medicare will be the first of the month that you're born on. Unless you're born on the first, then it will be the first of the prior month. You have 3 months prior to your birth month to go ahead and apply for your Parts A and B and get your supplemental and get your prescription plan effective the first of your birth month. And then you have 3 months after, if you forgot to get your prescription plan or anything else, where you can make that change, initial going on to Medicare. Your next time will be your annual enrollment period. And from October 15th to December 7th every year, you can make changes to your Medicare Advantage plans or your prescription plan. And you can go from Medicare Advantage to original and back. Medicare Advantage disenrollment period will be March 1st to 31st. They call it a disenrollment period, but during that period, you can also change your Medicare Advantage plan to a different Medicare Advantage plan. And you can also go back to original Medicare Just note you can't always get a Medicare supplemental unless you're in good health at that point. And then special enrollment periods. Of course, if you decide to continue with your work coverage and then retire, you would be in a special enrollment period to where you would be able to get onto Medicare. And there's other times, such as if you went into a nursing home, were eligible for Medicaid, or if you moved and lost your prescription coverage in one zip code, you would choose another. So that's the special enrollment periods.
Great. So let's talk a little bit more about that annual enrollment period. And that runs from October 15th through December 7th. And all changes made during the annual enrollment period become effective the first of the following year. So Linda, how does the annual enrollment period come into play for original Medicare versus Medicare Advantage?
Well, on the original Medicare side, you're going to have the option of changing your Part D prescription plan. And on the Medicare Advantage side, you're going to be able to change your whole plan each year if you chose to do so.
And what are the reasons you would need to change your Part D plan, and how would you choose your new plan?
Well, each year plans can come and go, and also they can make significant changes. So the company may look at your zero premium tier 1 drug that you're not paying any copay on, and they could say, we lost money on that medication last year, and they might move it to a tier 4. You don't want to find out in January when you go to pick up your medication that the cost is now $500. So it's pretty important to review your plans every year and to make sure that you're still in the most cost-effective plan. Medicare does have a tool to help you compare plans based on your medications. And again, we're always here to review and run medications for people. So you want to make sure your prescription drugs are covered, that they're still going to be covered. You might ask yourself, have there been any changes to my prescription plan or any of the medications on my plan for next year? Is my plan still available? And note that you can also join a plan here if you had not joined one originally. There may be penalties involved at that point.
And if a Part D plan will be changing, will folks get notified?
Yes. So their notices are typically sent out in September, and they're sent out from various companies explaining the changes to your plan for the following year. So you want to pay attention to these notices.
And now thinking a little bit about the Advantage side, what changes might you make during the annual open enrollment period in this area?
Well, you can change your Medicare Advantage plan to another Medicare Advantage plan. You can also change from Medicare Advantage to Original Medicare, in which case you would choose a Part D prescription plan and you apply for a Medicare supplement plan. Remember, if you have significant health issues, in most states, you may not be accepted into a supplement plan at this point, and your premium would then be based on your health and the possibility of the amount of time that you are on an Advantage plan. And third, you can change from Original Medicare to a Medicare Advantage plan during this time. And in that case, you would choose the plan that's best for you. Some of the things you want to note or questions you want to ask yourself are, what do I like and not like about my current plan? Have the plan's monthly premium changed? Have out-of-pocket costs changed? Are the doctors and hospitals that I prefer still in my plan's network? And just like the prescription side, are the prescriptions being covered well on your Advantage plan for the following year?
Great, thank you for explaining that. And now, thinking forward to 2023, what are some of the changes people can expect?
Well, I'm really happy to say that there will be no copays on shingles or pneumonia vaccines. I get a lot of calls about the shingles vaccine. It's taken Medicare quite a while to finally pay for those shingles vaccines. The Part B premiums are going down next year, not up. So the lowest amount, 170.10, will be going down. There's going to be a lot of prescription plan changes. So on the prescription side, you really want to make sure that there's no changes to your medications. The good thing that many people are going to be excited about is there will be a $35 maximum copay for some insulins on certain plans. So if you're on insulin, you want to make sure that your plan will abide by that. And if not, you may want to look at other plans. There will be no deductible on the same insulins. And some plans are adding the deductible to tier 2 drugs. So you want to make sure that that's not happening to any of your medications.
So quite a bit to be on the lookout for.
Yes.
And that really concludes all of the content for our conversation today. So I just want to thank everybody for joining us today. Linda, thank you for taking the time to speak with us and sharing your expertise.
Thank you for having me. It's been a pleasure, Megan.
And please note, we will be sharing the recording of this event so you can share with anyone who may find this helpful. When it comes to making these important retirement and financial planning decisions, we are here to work together on developing a thoughtful strategy to make these transitions as seamless as possible. As open enrollment begins for some of you, and initial Medicare enrollment is on the horizon for others, please know we're here to help. Thank you again, and have a wonderful evening.